advanced group around in North America, certainly, and maybe elsewhere in the world, really looking at both not only physical activity relationships, but also air pollution exposure and other predictors. And I'm thinking in the future, and I didn't write this into my talk, but we've been doing a lot of work where people live on their home environment, and we really haven't done that much on work environment related to physical activity and how that affects people's travel, diet and physical activity, how that affects obesity and chronic disease. But that might be a nice synergy for us in OEH, which has environmental, occupational connections. So the occupational side may start to be a really good opportunity. The lab, I wanted to mention Dr. Andy Hong and Dr. Leonard Mackler. We're on the 3rd floor, so for those of you who don't know, we're here in SPPH. We work nationally and internationally on these topics. We also work a lot locally. We just got a new project funded by TransLink, Metro, Vancouver, the City of Vancouver, and the BC Real Estate Foundation, where we're going to take the My Health, My Community survey and match it to our environmental surfaces, the walkability surface, bikeability perhaps, hopefully air pollution exposure as well, maybe noise. And so we're really looking at that new 33,000 person survey that's a one-time starting cross-sectional initially is going to become longitudinal. So that's a really good source of data for your research to be thinking about. It is a unique data set, and the health authority is really collaborative. They want to work with us, so they're actually our partner in that project. Jat Sandhu, who's pretty senior at the health authorities, our co-investigator. It's pretty exciting. And we'll be developing policy around our own community and having workshops with people here in our community. So that'll be, I think, a good platform for maybe the province to get interested. When we talk about walkability now, we're really talking about something that's not very affordable. We're literally promoting a product that's undersupplied. It's become an equity. It's become a social justice issue. People here have to drive to qualify for a mortgage or to find a place to live. That is, as students, I think you probably can relate. Finding an apartment, or let alone, a mortgage sounds way off, but I mean, just having a place to live that you can afford, whatever that means driving further, and that's not healthy, or means traveling further. So that's a big problem we have. We have a crisis, an affordability issue. Hopefully the province will get into this game, and now that the province is, basically with the real estate transfer tax has gained a tremendous amount of revenue out of the real estate inflation, maybe there's some opportunities for us at the university to do something about joining housing affordability with transportation, land use, and public health. We've been doing a couple studies that you might be interested in right now underway. We're doing a project with the Generation Study. John Spinelli was the head of it, and now Trevor Dummer, I think, is taken over, and that's a really interesting project where we've already got funding from CIHR to match to look at the built environment effect on PC Generation's participants, about 18,000. And why we're interested in that is that that's directly linked to medical health records. So we're actually able to match healthcare utilization and cost with built environment features and have the pathway of physical activity and behavioral between the environment and where people and their health outcomes. So that's something really interesting. And then the mover study, we have a smaller sample size, a lot of detail, and about 250 people in our region that have moved. So if I'm mentioning this because some of you may be interested. There has causal inference. How does changing your environment affect your health characteristics and your behavior? We can learn about that from that data set. And we're actually looking for people on all these who want to do data analysis. Finally, NewPath. It's a study we did in Waterloo. It's a very large sample size. We have a tremendous amount of travel diary information, objective physical activity data, and we have built environment, very detailed and measured. And we're basically, on a clock in terms of having access to this data because we collected it a while ago, and we haven't fully analyzed it. So there's a huge amount of opportunity to look at if anybody's from Waterloo or likes Waterloo or wants to go there or knows about it or whatever, but we know a lot about it. And what's really great about that study is that we oversampled along the rail corridor, and they've now built a rail line in Waterloo, and we're going to do we hope to do a prospective follow-up. So we've oversampled. That'll be a really interesting study. It will be one of the first longitudinal rail studies in Canada. It might actually end up being the first. So what's happening in this science, and I thought I'd give more overview, is people are trying to link environmental features with health outcomes. And I mentioned that when I started. But the point is to try to document causation. How does changing an environment, whether you have to move or your environment changes, affect behavior. So as the science evolves, we start trying to establish hypotheses, and partly induction through inductive reasoning and observation cross-sectionally, and develop those hypotheses and then test them if it's causal. If in fact, and in public health, you're very familiar with this. I come from transportation and urban planning. They're not familiar with that. That's not common, that's not typically done, but it's important that it be done. So evaluating natural environment features is really happening more now. There's a lot of work underway here on that. Evaluating microscale, the pedestrian environment. So now that we know, when we talk about walkability, we're talking about distance to shops and services, how dense or compact is a neighborhood, does it have good transit service? We add that into our definition of walkability. Is it a connected street grid, or is it cul-de-sacs that you can't get through? So that's walkability, but really the pedestrian environment, the microscale environment, the sidewalks, are they there? Are they good? Are they lit? Is there seating if you're a senior or anyone else who needs to sit down? Is that provided? Are there eyes on the street? Is there surveillance? That's the pedestrian environment, and that's been measured now. And so that's the new wave of publishing, is getting at those features. That's very important from a policy perspective, because you can have a walkable place, meaning there's shops and destinations, transit nearby, but if the pedestrian environment doesn't support it, people won't walk. And so from a cost-benefit perspective, decision makers care because the seating and the lighting and the vegetation and the eyes on the street's cheap compared to the cost of changing environments in other ways. So the cost-benefit, which is getting at the next point, which is monetizing these relationships, half of what we do is trying to put dollar signs on this, because until we do that, we feel like decision makers don't really care. And I have a feeling they won't care anyway still. I mean, they'll care, but the ability to move attention away from automobile dominance, which we have, is so difficult because we're so entrenched in our culture, in our industries. Everything is built around it, but I think the monetization helps, at least makes the business case that it matters. And we almost can't afford, I think we're getting to the point, to not care about it. And that's really where things then start to shift. And then applying the evidence to predictive tools is something that's happening now, because there is enough evidence. I've used this image before, so for those who've seen it before, sorry, but I gotta use it again. But these are the pathways. We talk about what are they. When we start over here, built environment. In urban planning, the biggest debate, and it's still going on, is transportation and land use interaction. When you build a train line, does the development show up? Like on Canby. When you make it easier to access a certain location, how well are we able to predict, will developers come? Will they build there? So that's the linkage. When we make land use decisions, what kind of transportation investments are then needed? This is interjurisdictional. Municipalities make these decisions. Land use decisions are not made by the province. They're not made by senior government. Local governments are given the authority to control land. What? Use the mouse. Oh, sorry. Oh, mine's okay. So anyways, so land use and transportation interact. My dissertation is on land use transportation interaction. But basically we care about it because that affects behavior. We think it does, but we hadn't really measured it until now in a causal way. Now we are. Those pathways are behavioral and exposure-based, and they both matter. And the idea is to converge them in research now, where we're actually looking at dietary energy balance, physical activity and diet, how that affects body weight or healthy body weight, obesity or not, and how that relates to chronic disease. But there's a direct effect on our behavior in terms of diet and physical activity on chronic disease, irrespective of weight. It matters, regardless of your weight, if you're active or not. It's very, I think, solid research. And then you get over here and you look at the exposure pathway as well, and we get injuries, respiratory function, a lot of the work that Mike and others here in public health have been working on. There's a lot of, so it kind of fits together on the exposure and behavior, because if you are looking, for example, at cardiovascular disease, and you look at one pathway, which is exposure to air pollution, and you look at the mechanisms there, but not understanding the effect of the environment on physical activity, then you're missing part of the story, and we're doing the same. So trying to bring the air pollution exposure and injury exposures, noise, air, and injury together with behavior is very important. And in fact, the interventions that we promote, physical activity, arguably increase exposure to air pollution. And the question is, how do you design an environment where you get the win out of walkability, getting people more active, but not the lose out of exposure to air pollution. I think that's one of the big issues. And then, of course, monetizing all that. And healthcare utilization is a behavior that we can model. We've not done that much. No one's really done that, how that relates to environment. But if you're locating hospitals and healthcare facilities and you're providing healthcare services, you really care about utilization. There's a big debate. Does providing a more walkable environment and decentralizing healthcare services increase the uptake in the service? Is that behavior rather than incident and developing further down the path, getting people who might be more ill or infirm? So healthcare utilization and then healthcare costs, all related. Less chronic disease, that's the theory anyways. There's a big question around, should we be looking at mortality or morbidity when we monetize these outcomes? I'm a firm believer in morbidity being the right thing to look at. I don't see the cost savings. There's a tool called HEAT. Anybody heard of HEAT? HEAT is used, and this the World Health Organization is adopted it as its tool to link built-in transportation and health. It's problematic. It's basically putting a value on, I mean, it has some benefit, but it's putting a dollar sign on life, which is commonly done in public health. But one of the questions that I think many people have is, keeping people alive longer doesn't necessarily save you money. It's the right thing to do. But morbidity is we want to keep people well and healthy longer. And I think that's the question that we have. Several studies have shown compact, walkable, transit-oriented neighborhoods are associated, cross-sectionally associated with improved health outcomes, including blood pressure reduction, as cardiovascular disease reduction, and mostly CVD and diabetes is where we've been in this. A San Diego study, we had 18,000 people. We found and this is what we're finding, about a 10% reduction in the odds of type 2 diabetes from being in the more walkable environments versus the least, and a 15% reduction, a little bit more on the cardiovascular disease. One of the problems we have, of course, is these are comorbidities, so we have to account for the fact that you might have both. So we address that from living in more walkable environments. In Vancouver, we have really good data. We've been measuring this for a while. We make this data available to students who are interested in using it. Any of you are. We're now having a discussion nationally, more than a discussion. There's a project called, a program called Canoe, which many of you are part of or aware of. So now we're talking about because we've been measuring walkability for decades, and we've got a lot of walkability data sets. So one idea is to sort of contribute all of our data to Canoe and then open it up so more people can use it, but we have to, of course, be careful about confidentiality and also making sure the studies that are happening relate well and form a coherent package with what we're already doing. But that's something that we're going to do. We're going to try to figure out how to make that work. Others will too. And in return, hopefully increase the capacity for other things to be done. Maybe we can get walkability measured in the same way across Canada to have a consistent measurement, and maybe we'll be able to get another time point measured so we can detect change in walkability and change in built environment over time with these longitudinal cohorts that are being underway already. So that's the theory anyways. These are just, I've used this image a good bit, but basically these are the factors that we have in our walkability index. We live in a three-dimensional world. We're in the ground basement floor of a building. We've got 4 stories. You can measure walkability about 150 different ways. So they're not all created equal, but one thing that is important is to capture three-dimensionality. Skyscrapers are quite different than a flat parking lot. And that's actually the level of difference that we have in measurement going on. We use parcel data, that's assessor's data. Each unit of land, we know the amount of floor space, and we look at the variation or distribution. How evenly is floor space distributed across uses? So if you have 1 million square feet and you have 10 different land use types, retail and commercial and residential and office, is it evenly distributed? We theoretically would assign the highest value to that. So that's just one measure is mixed use. But when we look at retail floor area ratio, this is the ratio of square footage of retail building onto the land it's on. Basically, this is capturing this measure here, and these are figure ground diagrams. It's not the best diagram here, but think of 4th Avenue or Broadway here in Vancouver. The buildings are right up to the street. When you're walking along 4th Avenue, you've got shops and you're right up to the street. The building fills the entire envelope. Parking is either in the back or somewhere else, maybe on the street. Then think of walking along Boundary in Burnaby, where everything's set behind a sea of parking. That's what that measure is capturing. This is what we call a proxy or surrogate. This is capturing a pedestrian environment or not, pedestrian orientation or not. You need floor space, square footage to do that, and it's our best predictor. So we have a lot of debate in the literature around this, but this is sort of the way that we try to measure it. So we have plates for the whole region. Every census block group it's a postal code. We've buffered are you all familiar with postal code versus dissemination area or blocks and tracts and census scale and size? Everybody pretty up to speed on all that? So postal codes are tiny. We like tiny because you can always aggregate up. We buffer, and I'm going to talk about buffering because there's a whole big piece of research going on around how to buffer. And I'll mention that sort of how to define the area that people can access from a given location. So this is just showing Ambleside versus downtown New Westminster or Metrotown, and you can see the net residential density differentials. Downtown is the densest from a residential perspective. Commercial density is higher. This is the retail floor area ratio. This is what I just talked about, having the building fill up to the street. No sea of parking. That's less surface parking. Maybe we should just call it that. The higher the mixed measure, the better, and then you get your overall rating, and well, of course, downtown New Westminster is pretty walkable. I did that for a political reason, put this slide together. Everybody thinks that Vancouver is the only walkable part of our region, but it's not. There's also White Rock and New Westminster and a few other places that were developed before the car. That's about it. A walkability map is a time map. You're like looking back in time, effectively. But now we're turning the corner and we're starting to see new places emerge as walkable, and you can sort of point out that there's part of West Vancouver and North Vancouver is changing very dramatically. That's really interesting. They have a lot of interest in attracting residential. They have a lot of jobs. They were the number one job. Job growth was the highest in the country, and the mayor's really keen on this. So there's a lot of unmet demand for all this stuff. We surveyed about 1,200 people and found that 1 out of every 3 people in automobile-oriented places would prefer to live in transit-supportive environments. 60% of our participants stated a willingness to trade off features of automobile orientation for walkable communities well served by public transit. That's this affordability issue. There's a reason. There's an unmet demand. We can't keep up. Transit users are typically more physically active. Everybody would get that pathway, so we call that a cross elasticity. When you improve transit service, you get people walking. When you widen a road, you shift people to cars and you reduce walking and you reduce transit. These are compensatory. It's basically discrete choice analysis. You all heard of discrete choice modeling? This is a multinomial. We use logit discrete choice to predict odds ratios, not just like a dichotomized measure using a logistical regression. This is the difference between a nominal set of measures, which would be I walk, I bike, I take transit, I drive, I carpool. So we're looking at the relationship. It's a simultaneous set of equations that looks at, it's basically what's used in consumer science. It's what Daniel McFadden won the Nobel Prize for back in 1979 or 80. And it's that discrete choice, observation-specific kind of a and it's used to predict whether or not people will buy Colgate or Crest toothpaste. It's just purely that. And transportation is a consumer science. It's grounded in microeconomic theory, very grounded in microeconomic theory and Newtonian physics. It's based on the gravity model. The gravity model is what we use to predict where people will go. And it basically determines the likelihood you're going to go to a location as a function of how far away it is and how much of a pull it is. How much is there to draw you to it? If New Westminster grows big time, gets a lot more development, we're all going to be more likely to go there. So that's the distance and all that. So that's the gravity model, and it's used in transportation very much. So buffer types. We just got a paper accepted in a Health Geographic journal. And this is sort of where we're at. We're looking at, this is how buffers started when we got to the ability in GIS to develop observation-specific buffer, which was about 15 years ago now. Until 15 years ago, we couldn't even do this. We would just use census tracts and know where people were in a census location. So this is how it started, and we had all these kind of anomalies, and we would just have, the software would just draw this squiggly line. Then we were able to just look at people that could actually access. So this is an individual in a survey. And we're trying to compare how their environment, differences in their environment explain differences in their behavior. So when we do this, here we have observations in 3 different types of buffers. It's the same environment measured over time. We've gotten, we think, better and better, and the results confirm we have. But you can just look at the different kinds of environments. So this is an urban versus semi-rural using the original detailed buffer, where we were able to get away finally from drawing a circle. And the way we did it was we just estimated on the road network a kilometer, and we got this sort of a shape. So you have all these partial parcels. Here and here's a rural area, and it's even worse in a rural environment. You can't really barely measure anything. Then it got better, and we could do these detailed buffers where we started to get rid of these partial parcels at the edge, but we still had this kind of setup. Now we're actually to the point where we think we have the best we can get, roughly speaking, of simulating what a person can actually access. That if you leave your house and you live in this environment, you're not going to be able to access these internal spaces here, but you can, this is what we call a sausage buffer. And that's what we tested was, and we validated that that was a better way to measure built environment. So we're from a policymaker, we're splitting hairs. From a research perspective, we're refining the science. And that's what we like to do. So we had data from a bunch of countries, and we compared their outcomes, and that paper is available if anybody's interested. We looked at, as a validation, number of days people walked for transport, minutes they walked, number of days they walked for leisure, in minutes, so frequency and duration, and then time spent sitting from the International Physical Activity Questionnaire, so we use self-report. This is just to show you census block group in the US equals dissemination area. This is, I'm going to show you 2 maps of San Diego. These are where we layer phenomenon, just showing you another way we do research. It could be fairly simplistic data, descriptive information, but here we have traffic volume density, arterial density, this is the amount of vehicle movement, vacant parcels, physical disorder, and violent crime, where we've defined all these factors that we know from the literature are associated with less walking. And we conflate them to tell a story to the public. That these, when you take these factors and you layer them, you get a situation that's really difficult for people to walk in. Well, how does that relate to where poor people live, who can't get around, who don't have as much opportunity for access to it? And how does that explain then, chronic disease? So that's what we're trying to do, and they love that. So this became the Healthy Communities Atlas in San Diego, and what it was we were building a predictive software tool, and on the way to building the tool, we needed to build all this data, and I thought, why not make that a product? Just let them have this as a map. Show them those descriptive statistics are often really good for policymakers. They can understand them. It's very simple. Here's good, here's bad, whatever, So, but layering them together starts to tell a story when you add them up, stack them vertically. That's what this is. Well, those are the bad news, but here's the good news. Here's where there's transit. Here's where they have sidewalks. And here they have non-motorized access. Well, it turns out to be where rich people live. So, and here, if you look at it, more or less, in the old town centers. But this is all La Jolla, which is very wealthy, and they've got, as you'd expect, a good pedestrian environment. They have access to transit, but it's not only wealthy areas. So one of the things that we're doing here in Vancouver, closer to home, is we're fortunate. We have a city and a mayor, although he may have gotten bad press in the paper, apparently called rock bottom. I think he's been a good mayor, but he's tough enough to weather that storm, I'm sure. So we did a study on Comox here in our lab, here in SPPH, on the Comox corridor. How many have biked on Comox Street since the bikeway's been put in? It's pretty neat. Comox was very walkable to begin with, so the task of showing that improved walking before and after was a challenge, but they gave us funding to do a before and after study on Comox corridor, and I'm just going to show you the results, and we hope to submit this soon for publication. So residents within half a kilometer, we surveyed. And we asked, what are the impacts on travel, perception of safety, social interaction, physical activity, and health, pre-post? Why? They wanted evidence to basically to support the Arbutus corridor and bigger stuff that was coming down the line. They spent $8 million on COMAX, 5 to 8 million, and I think from the results that we have, it looks like that we can monetize the benefits and show a tremendous payoff from a health perspective, and it just the way the results turned out. Here's when we did our sample. We did a questionnaire, neighborhood profile. We asked people a lot of questions about their preferences and attitudes, their demographic characteristics, and then we did a 2-day trip diary as well. And then we no accelerometers. We didn't have the budget for that. It is a longitudinal design. Cycling is the fastest growing mode share in Vancouver, increased by 40%. In the city's mindset, it's really where we have a lot of discussion from our leaders here, our elected officials. We hear a lot of what they're looking at. They want to be the greenest city. They call themselves that already. They want evidence to prove they really are. This is on my street. Anybody ever been to the Tandem Bike Cafe? It has really good. I mean, this is a change in culture, that you have a bike shop where people are working on cycling, fixing bikes, and serving food in the same little space. So we're seeing a change in bike retail will be coming more and more. So this is the growth in mode share is going to be biking. According to their targets, 2040, at least 2/3 of all trips they want to have on foot, bike, and transit. They want to shave the proportional share of trips by car. As we grow as a region, we're going to have another 1 million to 1.5 million people, and they want that growth to happen on cycling. They have a grand plan. COMAX is just a small part of it. I studied this number 3 here. But Arbutus is big, and that's, I think that's this line, looking at. So there would be, I think, a vision of a bicycle network that is a greenway plan, not just we have a bike network. And what would that look like? So greenways are helpful to expand opportunities for recreation, travel by foot and bike, as well as experience nature and city life. That's why it's called a greenway. This is the one we studied, COMAX, I mentioned. This is our sample after we recruited them. This is where they lived at time 1 and time 2. This was after. And we ended up with some people recruited that were a little further away that we used as controls to compare exposure to. It's not a full RCT, randomized control trial, but it is sort of a bit of a quasi one, because we did have enough people that were away from the corridor, still downtown, under similar characteristics. So this is what it looked like before. That's a pretty nice street. It wasn't like a bad place to begin with. So, can you show that putting a greenway there is going to increase walking? Probably not. We didn't claim we could, but we said we'd look at it and see what we learned. This is after. It's a reappropriation of road space is what this project really is about. This was before. It's after. Basically taking space and relative capacity away from the car. Before, and this is at the hospital. So important destination. So here's what we found. We looked at taking physical activity averages, percentage change. You can see the distribution on the top. But in a nutshell, participants living near the corridor, near COMAX, within a half a kilometer, a 6.5% decrease in sedentary time, a 4.7% decrease in time spent doing light physical activity. So, and then moving up the scale, an 18.8% increase in time spent doing moderate physical activity, biking at a regular pace, such as cycling, and a 4.4% increase in time spent doing vigorous. So, along the activity level continuum from light to moderate to sedentary light, we saw a shift up, which is good, as you can see. So we're happy about that. We can't say that we're completely 100% confident it's only because this corridor went in, but we have the same people before and after controlling for all other things that we could. Car sharing happened during this period of time, went in downtown in a big way. That actually made driving easier. That's working against the idea of the greenway, but it affected both the cases and the controls, and we can see that effect. And in fact, it made it easier to drive in a very walkable environment because parking is so expensive. So this is hard to see when I transferred the slide over, but basically the bike mode share, this makes me think of this quote by Benjamin Disraeli, this says there, and Mark Twain used, which is, there are three kinds of lies. Anybody know what they are? Lies, damn lies, and then what's the third? Statistics, there it is. So you can say, wow, there was such a percentage increase relative risk for relative. Biking went from 2.3 to 3.2%. So, that's not a lot of a jump, but it is a proportional jump that is significant. So we got to look at that data and understand the absolute numbers are dismal, very low comparatively. So really another way to look at it is incredible opportunity for improvement. This is a mode that has got a tremendous capacity because a lot of trips are a bikeable distance. Well, it's true. I mean, walking may not be possible, it's too far, but biking can work. So that's why I think, a lot of research here, and as people, we're doing a lot of work, a lot of studies on cycling, bikeability and all that. So I thought social interaction would be the big hit here. The big, when I went into this study, I thought, you're not going to get them to walk, but you're maybe moving walk trips from one street to another and getting people to walk on one corridor. There's a lot of seniors there. And maybe we're going to see social interaction. It got really close to statistically significant, but not quite. I bet when we shave off some of the younger people and have more of the older people as a more dominant share of I bet we'll see the significance get to be at a 0.05 level. But anyways, we saw some differences, some increase overall in whether people know their neighbors and social interaction. I bet we could resample these people after they've been there a while now and have changed their lifestyle a little bit, and maybe see those connections formed, and possibly because of the fact that they're walking to and from along the same corridor, because the West End has, in order to get to transit, you need to walk along this corridor or bike along it. For many people, they may choose to bike or travel along that corridor. So it is lovely now. And but basically, this is how the results can be presented: is that we have this increase in cycling and a decrease in driving and a decrease in time in cars, which we have shown that causes obesity or related to obesity, and an increase in number of days engaged in moderate physical activity, and a decrease in the number of poor health days. So everything went in the direction that we hoped, in a level that is reasonable. So that was a really good initial study. For a very small amount of money for the city. Results show that people felt better, were more active, and produced less greenhouse gas emissions. Victor No, who was my master's student and worked in our lab, did an amazing job in analyzing this data. And he took the travel diary data, and he turned the trips into greenhouse gas, converted the trips into emissions for vehicle trips. So now we have both the health argument and the climate change argument, and we're putting those together into a single argument for the benefits of investing in greenways. So you get multiple benefits is really where we think that maybe stacks up nicely. So I'll conclude on this. I think you probably know this, but most of us do not meet the guidelines for physical activity. And I think you probably gathered that from my talk. So another thing I need to. So let me see. I'm going to wrap up about 5 minutes. Okay, cool. So there's this thing called connecting green spaces is been fused grid. So this is an idea of, okay, we've built a lot. The problem with the built environment is that it's built. That's what it's to talk about. When we talk about interventions, maybe it would be better to look at the cost of insurance, car insurance, or things that we can, instruments, policy things that can get changed quickly. Put a tax in on congestion pricing. Why don't we tax the bridges, the road pricing, variable road pricing? That would be very fast and would shift behavior. That's a much quicker, would have payoff. You don't have to build anything. You just have to monitor people's behavior. That would be an intervention that would be fantastic. Well, politically, it's really difficult, but it's going to happen. But in the meantime, we are building communities, and we certainly don't want to build. We want to at least make sure that there's awareness of how to build community. There's a role for built environment, but it's slow to change. Well, one of the things we can do to retrofit is connect cul-de-sacs, disconnected environments in suburban settings. We don't have these in the city here in Vancouver, but there's plenty throughout the region with green space connections. linking up cul-de-sacs with sidewalks to nearby arterials. So this guy, Fanis Gramanos, who was with Canada Mortgage and Housing Corporation, really pushed this idea, and we did some work with him. And so results is basically, putting that green space to link up what are disconnected grids. So here's an example. What we did was, because there's not many fused grid places built, is that we have to come up with a research design that allows us to test this phenomenon. And this is the idea that we came up with. So here's Seattle, Queen Anne Hill, a connected area, very good grid network. Here's Bellevue across Lake Washington to the east, which is developed more recently under a suburban template of cul-de-sacs, disconnected streets, and the same with Redmond. So we developed a typology which takes, I thought of it actually by learning about epidemiological, where you take two juxtapose high-low for two phenomena to develop a high-high, low-low, low-high, and high-low. So the idea here is, what is this fused grid really trying to do? Well, what it's trying to do is change the relative utility between driving and walking. And the way you do it is that, so up here you have so this is upper right, is where you have high vehicular connectivity, meaning a connected grid, with sidewalks on every street. That's high-high. Both are all connected. This one down here is low-low. This is sprawl. This is no sidewalks, suburbia. Okay, that's the worst case. Over here, we have basically high vehicle connectivity, low pedestrian connectivity. These are large blocks. So it still has vehicular connectivity, but it's hard to walk around even if there are sidewalks. This one here's the fused grid. This is where you have low vehicular, basically you're traffic calming streets where you block off streets and where you have people can walk through. That's simple as that. So the idea is the relative utility. So it's an intervention that if you were to say, you know what, in a suburban setting, instead of connecting up the streets, we're just going to connect it up with sidewalks. It's a simple, but that's the essence underneath. So we measured places in Seattle that had that. Just took traffic calm streets where we had survey data and looked at the effect relative to others. So basically, it's a little reversed here, but basically the worst case in terms of walking or lower is in low pedestrian connectivity. Just 10% of trips were by walking. We have a lot of places like that. 985 people in our sample. They were mostly here. They were here and they were here. The grid places. So here we see 14%. So these are both low. 10% is a low percentage of walking, not relative to the whole region, but where we sampled. The best case is the fused grid. So we just saw a slight increase. So what this means is that compared to places that have good gridded networks with sidewalks, if you put in some traffic calming and make it harder for people to drive, some of them will shift to walking, we think. But we don't have a longitudinal study, but it shows some possible benefit. And it's just, I showed it as an example where, given a research question with not the phenomenon directly to study, you can unpack what's behind it, or we think we kind of did, and showed that it does likely work with even limited data. But 4% is a significant shift when you have aggregate numbers like a transportation network across the surface of a region. That could be a major shift. So last point is on design elements. We're doing a lot of work mapping using Google Street View that we all use to look at neighborhoods, but we're now developed and validated a method to look at all these microscale features and then their effect on all the health outcomes, physical activity. So we're adding that and controlling for macro level walkability to know what is the additional benefit of these features. So using different tools, looking at these different factors in communities. I think I'm going to wrap up and maybe not present more and leave time for discussion so that there is that. But thank you for your attention, and I look forward to hearing any questions you have.
Okay, thank you, Dr. Frank, for their very interesting presentation. And we're going to open the floor up to questions.
So thanks, Larry. I always learn something whenever I hear you talk. That's great. So I wanted to ask you something you sort of touched upon, I guess, earlier, which is the issue of affordable housing and how it relates to some of these interventions. So one of the things I've kind of been, we're working on a project now where we're actually trying to sort of look at future scenarios. And when you, let's say when you green a neighborhood, gentrification happens, which raises prices, which actually just sends the people who are in the area somewhere else. Usually it's somewhere that's sort of less desirable. And I just wonder about your sort of thoughts about that, both in terms of studying it or any experiences about actually how we might address that whole issue.
That's great. Great question, Mike. Center for Neighborhood Technology in Chicago has developed about 8 years ago. Scott Bernstein, he's a researcher there, developed and put together, H plus T, housing plus transportation, into an index, because those two things are the most expensive things people spend their money on. Two of the most expensive. So the idea is that as housing costs, that they're inverse. Typically, we trade one off for the other. So we're willing to spend more on housing, then we don't have but the transportation costs tend to be blind to them. It's as if when you go look at the house, you see the granite and you see the features, and people buy the bonus room and all that, and they trade off that. I'm looking at Sarah, lived out in Michigan. I mean, the way we make decisions is complex, right? There's this very psychological thing that goes on. So it's easy to discount transportation costs. So that's one of the parts that we need to learn more about, is that decision-making process. And then this inverse relationship that we can, there's another a really good report called Driven to Spend, you may have heard of, which is really failure to monetize in our own lives the incredible cost of transportation and its many manifestations. So I think that we should be doing longitudinal studies that measure this displacement phenomenon, first of all, to the extent it's happening, because as gentrification is happening, there is this where are people going? To actually be tracking through census data, perhaps we can do that. Maybe I don't even know if that's the right. Maybe it is. I don't think we could get that data, but individual level. But we should be looking at migratory patterns or movement, and understand the degree to which displacement is happening and to what extent. I don't think we have a good sense at the individual level. I don't think that's really been studied longitudinally. It's assumed, and we know it is happening. So from a health perspective, I think we would be good to document the degree to which that has adverse health impacts, displacement, and the cost effectiveness of supply. It really comes down to, what are we going to do about it? Is we need to supply more of walkable places, and how much more, and where, and how much would that more reduce the cost? Would it? And we're in a difficult situation in the sense we were before, because of the offshore investment was happening so much. Now I understand with the transfer tax, the offshore market is kind of pretty shut down. So it might be studyable now or researchable, but I wonder, I have a PhD student who's working on this question now. So what we're doing is taking demand profile for neighborhood type and matching that, trying to map it to supply profiles. We're trying to take the walkability surface and determine how many different households do we have, or dwellings. What's the supply of dwelling type by demand type by profile? And we would love some thoughts on how to do that better. We're working with Sir Somerville and Commerce, and trying to come up with how people sort themselves out based on the combination of factors of housing, the household, the structure, bedrooms, and whatever it is about the structure, and factors about community and how those go together into packages. And then how much of that stuff exists in reality and where the gaps are. I hope that was, I haven't thought a lot about, the vehicle ownership is a big part of this. Car sharing, it seems like fits in. I think people will relocate and feel, there's a piece around access to different modes. Thanks.
Hi, thank you. This is really interesting to me, the way that land use planning really directly influences human health. I'm wondering if you have noticed a connection between the size or population of the most local level of government electoral districts and their willingness to adopt pro-walkability changes. What I'm wondering is there a relationship, if you have lots and lots of small municipal governments with really tiny wards, are they more willing to take on, say, walkability initiatives, or do they foster NIMBYism or something like that?
Are you actually interested in measuring degree of representation?
Representation or just, say, willingness to pay for services that aren't, say, directly captured in the market price.
So bigger geography means less could be that your taxes go to fund infrastructure investments not near you.
Yeah, like if you have, like Vancouver has multiple municipal districts, and some of them have smaller roads than others. To some neighborhoods like Kitsilano or Point Grey that have been quite resistant to urban densification.
I've not seen studies that have tried to isolate the effect of the ratio of district or voting size of the voting area. I would imagine in political science, I would look in that literature. I mean, I don't know. I just don't know the answer to that. But it's what I do know is from a regional planning perspective, when you have tons of little municipalities, forget it. You know, it's not. And what happens is the municipalities compete for growth because that's economic development. They want jobs because tax producing growth. So the suburban jurisdictions, that's why we have a lot of that's what fuels sprawl. So you have all these outlying jurisdictions that and we have a suburban power block now, and the outlying jurisdictions get a certain amount of the growth. And they want to make sure they're going to get the infrastructure. They're going to say, we know we're going to grow, and therefore you must invest in infrastructure to support this growth. We invest in the infrastructure, and that's what allows the growth to happen. But it's a cycle, and we call that the self-fulfilling prophecy in transportation and land use. So what happened about 20 years ago was scenario planning tools started to get built. I don't know if you've all heard of scenario planning tools, but these are simpler modeling structures based on disaggregate behavior that I just presented kind of work that allows us to simulate like SimCity quickly, to get away from this whole political process of the allocation of jobs and households that's done everywhere in Western cultures around the world that then determines the so we allocate the growth because politically the power is there to say we are going to grow. And so having lots of little political units is bad. But having recently seen, so I always thought consolidation like Toronto had was ideal until Rob Ford became mayor. And then I saw that there's a downside to everything. You just need to wait long enough and you'll find it.
Larry, I'm going to jump in here with a couple of the online questions. So one is that public health practitioners in Ontario are trying to provide local planners with evidence-informed policies to reduce traffic pollution exposure, especially with respect to setback distances, barriers, and building ventilation systems. They've found the policies themselves haven't been evaluated for effectiveness. Is this consistent with your knowledge, or do you have any advice for translating existing evidence into usable tools and guidelines?
This topic is a better question for Dr. Mike Brower than me. So wait, repeat one more. Just this is building setback?
Yeah, so I think they're looking at providing good advice around building setbacks and exposures and not finding a lot of evidence evaluating different approaches.
Well, I really think this is better. It's directly his most core area of expertise.
Okay, well,
let me just say one thing, is that I think it's speaking to this question around, and Mike, please answer too, because you're here. But one of the things, basically what we're worried about is that air pollution exposure is greater in more walkable places. In the study with Julian Marshall that we did, we had a correlation of 0.6 for NO as a marker for particulates and overall. So that's a problem. But we do know that particulates disperse out of the air or leach out of the air very quickly from roadway edge. So it is possible that a design template could be created where we could push development back from roadway edge and have residential perhaps on the backside, commercial corridors and moving goods and trucks that produce a lot of the particulates, that we should be, the strategy is that we should be building our communities so that the residential areas where seniors live that are more sensitive is not in areas that have highest concentrations of truck movement. And I don't know the exact distances. There's a meta-analysis that was done in California, and maybe Mike want to add a bit?
Okay, I've
I really can't answer
put
that.
Mike's email out there so people who want further information can
That's
contact him.
not my area. That's
Fair enough.
That's Mike's.
There's a bunch of questions online. I'm just going to ask one more. In your national discussions, do you see any merit in promoting community mailboxes versus door-to-door delivery to increase accumulated walking time within the general population?
Absolutely.
It's not a loaded question at all, Larry.
Absolutely. I think people will actually get to know their neighbors while they're walking. I couldn't think of anything better. No, and in fact, it speaks to the mindset of the kind of strategies that we need, though, because those are an example. But there's lots of examples like that where you end up with. That's why transit promotes physical activity, is that everybody has their own car and their own driveway. It's all very individualistic. But when you have transit, people actually walk over to a place together collectively, and they're able to join up and go somewhere in a more efficient mode of transportation, pollute less while they're doing it, and they're also getting physical activity. So it's a whole lot of things like that.
Just one real quick question. In regards to walkability and everything, do you come up against like people still have the American dream? They want to have a freehold house. They want to have a yard. They want to have their picket fence. They want to have all that stuff. And my wife and I just went through a transition where we realized we'll only ever be able to have a condo and freehold unless we want to move to Hope. So we bought up at SFU and the university, and the positives are immense. Things that we never realized we would have had, but we had to change our view. And so, how can you communicate this to people so that they can see the value in not having a backyard or their own driveway or things like that I held on to very strongly, and I know a lot of other people did for reasons they don't really understand.
I think you made a good testimony yourself as the benefits of it. It's actually accounts, individual accounts, that will help, I think, a lot, where people can relate to someone who's like themselves more and more. But in fact, when we do our research, we have to ask people their preferences and attitudes. That preference survey I showed a little piece of is actually in our interest of measuring causal relationship, or stripping away the effect of attitude and predisposition from environment. So we end up with a lot of this market data that can be used to understand people's preferences. I think, in fact, your generation is breaking that mold, partly perhaps by price, but actually a lot by choice. The sharing economy is a manifestation of that never would have happened 20 years ago, where people are sharing cars, sharing bikes, whatever, all the, Uber is an incredible phenomenon. I mean, I think that we are definitely moving away. Automobile driver's licenses, I'm sure you've seen the graphs show it's extremely low for younger folks now. So we're in a different world now, and I think people are recognizing there's a huge amount of benefit that comes from not having to have all that separation of space that used to be part of the dream. So I think we're actually shifting away from it.
I was just saying that if I were to be living near the Comox, the only thing that will prevent me from biking will be the fact that I do not own a bike. But if I had access to a rental, I would definitely do that. So are there any plans to incorporate bike rentals in the built environment?
So thank you for your question. Your name is Essie? Bike sharing has now been instituted across the city, so there's bike sharing right there, and you can bike share and get a bike, and it's really great. So you can look it up online and see where they actually have maps and show where the bike share stations are. So yes, there's definitely bike rental, near term or even longer term, and all that. Yeah. And
Okay. So it looks like we're out of time. So thanks everyone in our online audience for being with us today. Please join me in thanking Dr. Frank for his presentation. Enjoy the rest of your day.